Hi everyone, my name is Lauren Estes and I'm an MD candidate in the class of 2023 at Indiana University School of Medicine. Today I'm going to give a brief review of the effect of methylene blue on pulse oximetry. A pulse oximeter is a small piece of equipment that fits over the tip of the finger and is used to measure oxygen saturation and can diagnose hypoxia intraoperatively. The key principle that allows for the measurement of oxygen saturation is that oxyhemoglobin absorbs more infrared light, while deoxyhemoglobin absorbs more red light. One factor that affects an accurate pulse oximeter reading is the use of methylene blue. Methylene blue is a medication used to treat methemoglobinemia, which is an inherited disorder in which blood has a higher than normal concentration of methemoglobin. However, methylene blue also has surgical relevance as an intravenous dye used to identify sentinel lymph nodes in breast surgery, which you can see here, as well as to identify damage to the ureters in urologic surgery. As we discussed earlier, the function of pulse oximetry is dependent on the different absorption spectra of oxyhemoglobin and deoxyhemoglobin. Methylene blue interferes with an accurate reading because as a blue dye that's injected into the vasculature, it has its own spectral absorption peak. The spectral absorption peak for methylene blue is 668 nanometers, right here. This is much closer to the 650 nanometer spectral absorption peak of red light, right here, and much further from the spectral absorption peak of infrared light, which is up at about 950 nanometers. What this means is that the pulse oximeter interprets this to mean an increased quantity of deoxyhemoglobin. This means that a patient being treated with methylene blue can have a falsely low pulse oximeter reading. One case report describes a healthy young surgical patient who was satting in the high 90s at the start of a case, who appeared to desat to the low 70s within 30 seconds of receiving methylene blue. Her oxygen saturation returned to the high 90s after 4 minutes, and she had no changes in her other vitals. The take-home point here is that the spectral absorption peak of methylene blue interferes with the mechanism of pulse oximeters, and providers should be aware that patients receiving intravenous methylene blue may have falsely low pulse oximetry readings. Thank you so much for your time.